and welcome to live stream of AVA Hospital. It's been quite hectic and busy the last couple of days, so it took us a while to have this live stream. But we want to talk today about 3 patients in a row, and they all come. 2 of them come from America, and 1 flew all the way from Singapore to see us. And we want to talk about 3 different techniques applying to 3 different patients, 3 different body type. So let's talk to Dr. K and see what has he done for the patients. Okay.
Hi guys, so yes, I've been quite delayed with my live stream because over the course of 2 days, I've been taking care of these 3 ladies here, as you can see. And these 2 come from the US, come from Singapore. And you can see very clearly on this picture that they have very different body type. Maybe this one and this one is a little bit similar in the amount of fat that they have, but this one is very slim, and all she has is just a little bit of fat in her anterior abdominal wall and a little bit to the waistline, which make her waist a little bit it can be smaller, and that's why she comes here. Anyways, I have 3 different patients, and I did a full range of procedures for them. As you can see, for this lady who only have problem with fat and very good skin quality, very good muscle quality, all she need was liposuction, right? So when I see a patient, there are 3 things I need to determine. Number 1 is the integrity of the muscle wall. Number 2, the amount of fat. And the 3rd thing, and the most important thing, is actually the skin, because the skin is the most difficult thing to take care of. We have skin tightening technology, but if you look at this lady here, whose skin quality is very poor, there's no tightening technology currently that can take care of that. So for her, I have to do the abdominoplasty.
Yes.
And you know, when she fly here, she didn't want that scar, right?
Yes.
She didn't want the abdominoplasty scar. She wanted me to just take care of her fat. But if you just take care of the fat and you don't address the skin, you're gonna have a worse aesthetic result. Yeah. And you know, I look at her and I told her everything I know about Renuvian, about body type, about Morpheus, and I told her that even this technology, if we use in combination multiple times, it's still not gonna help her. So for her, I steer her toward an abdominoplasty, a tummy tuck, and she finally agreed, and she's very happy with the result.
Yes.
So
that's a very, very sweet lady. She's the 30 years old lady, and she flew all the way from Singapore, and she had 3 kids before, and I spoke to her extensively, and she wasn't ready to have a scar, and she didn't want a tummy tuck. But it's a good thing that, you know, upon seeing Dr. K and talk to him during the consultation, the patient agrees, because that's the best thing, I think, which is for her.
Yeah, it is the best. I mean, yeah, we have to do what's at first she said that, you know, it's okay, I just want a smaller body, and then can I do a tummy tuck 6 months from now,
yes.
right? And you know, I have to address that, because a tummy tuck at this point, and a tummy tuck 6 months from now, after liposuction, after skin tightening, is a different type of tummy tuck. It's more difficult. It's take a longer time, longer recovery time, and you know, the result may not be as nice as this, and you know, all this traveling, extra cost. So it has to be the right indication, right? Although the patient may have different expectation, but we need to make them understand what is best for them. And then that's the one in the middle, in this picture here, where she clearly had, she also had, you know, similar size abdomen. You can see this one and this one almost the same size, but I ended up only doing the you know, mini abdominoplasty for her because she has very good abdominal wall, just a little bit of diastasis recti in the lower part, and then her skin quality is good. You know, with this kind of skin quality, you don't need to extract it, you don't need to resect it. So I only do a mini abdominoplasty for her. I extract 4 liters of fat for her, whereas, you know, the one who has a bigger abdomen with poorer skin quality, I only extract about 3 liters of fat. Again, it's not the amount, right? It's you have to think about what is left. You have to think about the skin quality, and it's actually the skin quality and the abdominal wall integrity that will determine which procedure that suits you the most. The fat is the easiest thing, you know. You know, I talked to one of the guys in Brazil, and he told me a clown with a cannula can do fat extraction, right? We surgeons, you guys are patients coming for plastic surgery. We have to be very clear about what you need to address your abdominal wall, to address your skin quality, and it's not just fat, right?
It's not just fat, yeah. Alrighty, thank you so much for sharing, and another
Okay.
case today, but we'll talk about it on a different live stream then. Thank you.
Thanks.